Hello, everyone. Welcome back to Neurospicy Nursing. This is a little micro lecture on torch infections, so hopefully we can get through this pretty quickly. All right. So, what does torch mean? So, torch is an acronym for different infections that a mother can end up with during pregnancy that can be very harmful to the fetus. T stands for toxoplasmosis, O is for other, R is for rubella, C is for cytomegalovirus, and H stands for herpes infection. We're about to go into a lot more depth on what each one of them means. So it's important because, like I just mentioned, it can cause miscarriages, stillbirth, or congenital abnormalities. Also, it's important to remember that it's going to affect the fetus a lot worse than it affects the mom. And it's important because also if we detect it early, we can, or prevent it, it's the best outcome for mom and baby. So, toxoplasmosis. It can be transmitted through cat feces as well as bird poop. So, if you're going through like their litter box or outside, if you have a lot of stray cats as well in the area through the soil, it can also be transmitted through undercooked cooked meat, unwashed produce, and it can go through the placenta blood barrier. The mom is often asymptomatic. If they do have symptoms, it's kind of like flu symptoms or lymphadenopathy. For the fetus, there's a classic triad. It's chorioretinitis, hydrocephalus, and intracranial calcification. They can also end up with seizures and they can have growth restrictions. Other There's a lot that goes into other. There's three main ones that we're going to be focusing in this lecture: syphilis, varicella, and parvo B19. So syphilis, it's transmitted through sexual contact and transplacental. The maternal symptoms are chancre or a rash on the palms and soles of their feet. And for the fetus, they can end up with a stillbirth or be stillborn. There's something called snuffles, which is bloody nasal discharge. It's also called syphilitic rhinitis. They can end up with a rash or bone deformities. Oops. There you go. Varicella is the next one. Its transmission is through respiratory droplets or if the mom has chickenpox. The maternal symptoms are the vesicular rash or fever, and then for the fetus, they can end up with limb hypoplasia, skin scarring, eye defects, and neurological impairments. Parvo B19. It's transmitted through respiratory droplets, and if they can also get it in daycare or if they have a toddler sibling that has it. For the mom, they can get arthralgia or mild flu-like symptoms. For the fetus, they can end up with severe anemia, which leads to hydrops fetalis, but they don't have any structural abnormalities. R stands for rubella. Its transmission is respiratory droplets, and it's also transplacental. All of these are transplacental. The maternal symptoms are going to be a low-grade fever, a rash, arthralgia, and lymphadenopathy. And the fetal red flags are sensory neural deafness, cataracts. They can end up with congenital heart defects like PDA. We're going to go more into that when we get into pediatrics. Or a blueberry muffin rash, which is basically just petechiae. C stands for CMV or cytomegalovirus. The transmission here is through saliva and urine, sexual contact, breast milk, and obviously transplacental. Mom is often symptomatic, but sometimes they have symptoms like mono. However, for the baby, they have periventricular calcifications. They can have microcephaly, hearing loss, petechiae, or hepatosplenomegaly. And then the last one, H, which is for herpes simplex virus. Transmission is going to be through the birth canal, which is most common. We have to make sure that they're having a C-section if they do have active herpes lesions, and transplacental, which is actually not super common in this case. The maternal symptoms are going to be painful genital lesions. They'll also have fever and malaise. And then the fetal red flags are going to be skin, eye, and mouth lesions, encephalitis, disseminated sepsis-like illnesses, and a high mortality if they are not treated. These are my resources, and thanks for coming along. I will be posting more micro lectures moving forward. Hopefully, this can be like the new type of content, just really quick lectures thrown at you guys. But yeah, thanks for coming. Bye. See you in the next one.